Hi, my name is Katie.
Hi, nice to meet you.
Hi, Mrs. Cummings. What's your name?
Sarah.
Sarah.
We just found out that she has celiac disease, so
Oh, okay.
that's why we came in to meet with you.
I see. What did you think, Mrs. Cummings, when Sarah was diagnosed with celiac disease? What were your first thoughts?
Well, I think it was very upsetting at first, but we also thought it through.
It's very overwhelming to many families when they find out that their child has this. And as a nurse, I'm able to give them the medical educational piece, as well as talk about the diet, and as well as look at them holistically to say, how are you all doing with this? How do you feel about this diagnosis?
So what we're going to do today is we're going to go through the fundamentals of celiac disease. And what I usually do is start out with a quiz, a true or false quiz. So here we go. Gluten is also found in art supplies such as Play-Doh, stickers, and paper mache.
Play-Doh.
Yes, absolutely. It's found in Play-Doh. And why do you think that is?
You use flour to make Play-Doh.
That's right. That's right. So the most important thing you have to do is wash your hands after you play with Play-Doh, okay? Because the protein gluten can't be absorbed through the skin. Mm-hmm. The concern is that it might get underneath their fingernails and inadvertently ingest gluten that way. Some of the books that I always recommend is by Dana Korn. This is her latest one and the most updated. It's fabulous reading. She has 3 books out, and they're all really very good for different reasons. And then the other book that I would highly recommend is Shelley Case, and you need to get the expanded edition. So, Mrs. Cummings, a few things that you might be able to do is it's important to have a meeting with everyone who's going to be taking care of Sarah during the school day to help keep her safe and not exposed to gluten. Okay. You could have a meeting with the school nurse, the teacher, the food manager.
At what point will Sarah start to feel better?
That's a good question. Many parents ask that question. It varies for each child when they're going to be completely better. For the most part, most children feel better right away on a gluten-free diet. Okay. But there may be some days that she has a tummy ache or doesn't feel good, and that can be normal. If that persists, then you should definitely go back to Dr. Leitner, let him know. And, usually the first thing that we want to make sure is that, gluten is not continuing to get into the diet.
How much gluten is safe? Can she have a little bit and that's okay? Or do I need to make sure it's perfect?
Theoretically, no. It's not okay for any gluten to get in. But children can't live in a bubble. And there will be times when gluten accidentally gets ingested.
Okay. But that should be our goal, 100%.
100% gluten-free.
Okay.
Yes.
How you need to look at this is nothing's being taken away from you. What we're doing is we're learning where gluten is in foods, and we're going to take those foods and we're going to substitute it with other foods that are safe for you.
So it was lovely to meet you and Sarah today. Please follow up with the nutritionist in a month from now, and also please make a follow-up with me if you have any additional questions or if I can help you at all in the school setting. And best of luck.
Thank you very much.
Okay.